we mistakenly began the meeting that should have been public on the link for the closed session. That explains the confusion. So we will disregard what has already happened. We will restart the meeting, and I will call the meeting to order. I apologize to everyone who has been suffering through this the last half hour. So with the meeting called to order, Penny, can you take roll, please?
Dr. Smith,
Here.
Ms. Rios,
Who?
Nina?
Yes, here.
Dr. Khan,
Here.
Dr. Hubner,
Here.
Bishop Hankerson.
Here.
Thank you. Oh, Dr. McBride.
Okay.
Here.
Okay, going forward, for the benefit of both the board and the public, when there is a closed session that will be necessary, going forward, links that will be sent to board members or anyone from the county counselor's office who needs to be part of a closed session, those links will be delineated in the subject line of an email so that you can properly know that we'll always start the meeting with the public link and then may need to use the other link for the closed session part of the meeting, which we will have to go into shortly for legal advice. For now, I want to reintroduce, and I apologize, Bishop Hankerson and Nina, but I do want the public to know who you are. And I want, if you don't mind, for you to kind of reintroduce yourself to the board so that the public and the media have a chance to understand the perspective that you'll bring. Bishop Hankerson?
Mr. Chair, did you take with the roll taken? I apologize.
Excuse me, Jen?
Was the roll taken?
It
The roll
was,
of Members? Okay.
yes. Bishop Hankerson, one more time for us.
Yes, sir. God bless you again to everybody. I appreciate this opportunity, this golden opportunity to be able to serve our community with each and every one of you. My name, as is stated on the video, is Elijah Hosea Hankerson III. I am the pastor of the Life Center International Church of God in Christ. I am also the prelate of the Missouri Midwest Ecclesiastical Jurisdiction. That's our diocese of the Church of God in Christ. We're currently right now in our Holy Convocation or Convention. And so, again, it's a privilege to be here with you during this time. I also serve on the General Board of the Church of God in Christ. That is our highest board. And we are a denomination of 6.5 million members. In the community, I'm the immediate past president of the St. Louis Metropolitan Clergy Coalition. And of course, that organization is concerned about the health and well-being of citizens in our community. And I have served along with many of our civic officials for the betterment of the community. So that's what we bring to the table. As I stated in an earlier session, I do ask for the prayers of those that are viewing a part of this gathering, because my work in the community has always been a team effort between my wife and I, Rachel Hankerson. We were married for 23 years. Unfortunately, she passed away a year ago with stage 4 cancer. There was no warning of it. She was 47 years old. She was fine. We thought she just had a bad cold or possibly COVID, and went to the hospital, and they diagnosed her, and then 30 days later, she was gone. So I'm definitely serving in the community by the strength of God, because that was very devastating and still very devastating. So I'm honored to serve with these tremendous professionals in this capacity. God bless each and every one of you.
And you as well. And again, we're so sorry for your loss and appreciate your service. Nina Rios, can you introduce yourself to the public?
Thank you. I'm happy to be here, everyone, and it is nice to meet you all, some of you again. I'm an attorney and mediator, but I'm making my own path forward as a conflict and crisis specialist. I'm mid-launch of my own private practice, and the thing which brought me here to you is my desire to build bridges. I like working with people who disagree, and I can connect with most people, whether they're young or old, Democrats or Republicans, offenders, victims. And that ability to connect lets me mediate amongst the different groups. What also brings me here is my work with Places for People, which I left last year to start my own practice. For those who don't know, Places for People is a mental health agency in Soulard. The clients there had a severe mental illness, and often they also had a criminal record. Many of our clients were convicted or usually found NGRI. Some were transferred from prison, and we took them into our inpatient programs. And generally, what I learned was a lot of offenders were victims themselves. They just hadn't healed the trauma. Some of them also had undiagnosed or misdiagnosed conditions for years. Some needed access to resources, while others needed structure and those natural hard consequences that the justice system can deliver. But knowing who needed what was key to the successes there, and there were many. I saw people graduate from our programs and get off those papers that they like to call. And it's really due to efforts like Places for People and like those of the board that make those successes happen. And I'm honored to have been able to work with Places for People, and I'm honored now to work with you all. And I look forward to working with you. Thank you.
Thank you so much, Nina. We're thrilled to have someone with your background in mental health and conflict mediation. And of course, Bishop Hankerson, we're thrilled to have your community perspective joining the board. So thank you both for your service. Okay, now comes the challenging part. We are going to consider a motion to go into closed session pursuant for legal advice pursuant to section 610.021 subsection 1 of the revised statutes of the state of Missouri and section 114.020.1 subsection 1 of St. Louis County revised ordinances, such so that our new members can receive legal advice from the county counselor's office. This should be, so I move that we go into closed session for that reason. Is there a second to the motion?
Dr. Smith,
Aye.
Ms. Rios,
Aye.
Dr. McBride,
Yes.
Dr. Khan.
Aye.
Dr. Hubner,
Aye.
Bishop Hankerson.
Aye.
Okay, by a vote of 6-0, the board will be going into closed session briefly. And so we will leave this link. We will go to the original link that we used before. And for members of the public, we should be back on this link very shortly. Jen, we can't hear you.
Could I ask if Mr. Anders could arrange before we actually leave to go into closed session? Could Mr. Anders arrange for someone from the staff to sign in or stay on the open meeting link and just advise the public every moment or so that the board is in closed session and will return?
Yes. Anybody logged on?
They'll need to do it from another
You-
room.
You can see this logged on here. I am an computer.
Is there someone who could, from another computer, could, in another room, could do that?
Yes, we'll do that. We'll take care of it.
I had to say in the public meeting.
And keep the public, keep the
Yes.
public link open.
Yes, we will.
Thank
I was
you.
gonna do it anyways. Yeah, I'll do it
Okay.
anyways.
Can you do that at like the scout's office? Or just
Can you
right?
Oh.
just type? Can you just send a message?
I gotta take care of you.
Okay,
Oh, you already got it. Yep.
Send a
Okay.
message in the chat.
okay, yes, he'll do it through the chat.
Is the public able to view the chat function?
City's got it.
Oh, I should plug off.
Can you explain to Jen's satisfaction?
I will be letting them know periodically that we will be returning soon.
Okay, but won't you be in the closed session?
No,
You will not be in the closed session? Okay, that's fine. If you're staying in the open session and can do that, you'll need to do it in a different room, obviously.
Okay, thank you, Jen. Okay, we will now leave this session and we will go to the first link that you clicked on this morning, board members. Thank you.
Kenny? If we just stay in this, will it stay open and let us know?
I think that's.
Yeah,
correct.
Aaron,
Yep,
could you just inform the public every minute or so? Would that be possible? That the board is in closed session? Yeah, if you just stay on and don't leave.
Yeah.
we'll stay.
yeah, every couple minutes I can say we'll be back periodically.
That would be
That
great.
works. Yep,
Thank you very much.
great.
Well, I hope that was the right thing to do.
Yeah. Yeah.
For anybody listening, the board is currently in closed session and will return shortly. Hello.
Hello.
That was quick.
Yeah, we've done it so much this morning, I'm getting the hang of it now.
Right.
I was slow at first, but I think I have it now.
I guess that closed session really is only going to be a few minutes.
Yes, sir.
Good to meet you.
Nice meeting you. How are you doing today?
I'm okay. I heard your story and I apologize for your loss. I'm so sorry.
Yeah, thank you. It's devastating. So I'm really just now getting back into a lot of community work, slowly,
Understandable. Yeah.
but making it back slowly but surely. You've served on the board for a long time?
I'm not on the board.
Oh, you're not on the board.
No, I work for Justice Services. I'm the statistician for Justice Services.
Got
So
you.
I'm the one who presents the data and the dashboards.
Got you.
Yep.
That's an important job.
Somebody's got to do it, I guess. Yeah.
Yes. Now, are we on the right link?
What?
Are we on the correct link?
We are on the correct link. I guess I
Okay,
should
everyone just
note to the public again, if you are listening, we are on the correct link. The board is currently in closed session, but we will be back shortly in the next few minutes.
Oh, they're sending me another link. Let me get off of this one.
Oh, I thought you'd already come back from the closed session. Okay.
Am I in the public room?
I think you're in the public room.
Ah, of course I am. Okay.
Yeah, the bishop just came into this room as well.
Okay. All right.
Yep, I
Thank
think
you.
it's the other one, and we'll see you in a few minutes.
Yep. Thank you.
Sure. For anyone on, this is the correct room, but the board is temporarily in private session, in closed session. They will be back shortly. Hello, if you are on here, this is the correct link. The board is currently in closed session and will be back shortly. The board will be back shortly. They are currently in closed session. You are on the right link. The board will be back. The board is currently in closed session and will be back shortly. You guys back, Beth? Okay, sounds good.
Yep.
I'm gonna leave the agenda and ask. Dr. This. Board.
I think you should do the review first.
See Dr. Khan. There it is.
You would lose Carl.
Carl is now panelist, and I'm about to make me presenter, so if you need to shift.
Excellent. Okay, thank you so much.
Okay.
Okay. Is Dr. Khan? Maybe.
Look for Dr. Khan, final comment. If you could promote me, that would be great.
Mr. Chair, I think Ms. Robb needs to be promoted to a panelist as well.
Okay. Um, We are back into open session. Do we need a motion to? No, we're okay. So we're back in open session. Let's go to the next agenda item, which is approval of the June 3rd, 2022 meeting minutes that was sent to the board this week. I move that we approve the June meeting minutes. Is there a second to the motion? Is there any discussion on the motion? Hearing none?
Dr. Smith,
Aye.
Ms. Rios,
Aye.
Dr. McBride,
Aye.
Dr. Khan,
Aye.
Dr. Hubner,
Aye.
Bishop Hankerson.
Aye.
Yes, Ms. Rios, I'm sorry.
Okay.
I'm sorry.
Okay, before we go to the presentation from CGL, there have been questions both from the board and the public regarding deaths in the facility since the last meeting. I wanted to give Dr. Khan the opportunity to provide a timetable for for an autopsy or make any other comment from the health department regarding the death.
Thank you, Jeff. What I can tell you is,
Mr. Chair, I apologize for interrupting. Was that a matter that was placed on the agenda of the meeting?
No,
Yeah, I would suggest that since it was not placed on the agenda of the meeting, that you wait until a subsequent meeting to discuss that.
thank you for the legal advice, but I think we would like to hear what Dr. Khan was about to say.
all I was going to say is there is no timetable and I cannot provide one. The forensic pathologists at the medical examiner's office will conduct.
Okay. Thank you, Dr. Khan. All right, I would like to move on to the CGL presentation. I believe it was fall of 2020 that this board resolved in a unanimous vote to seek a review, a comprehensive review of everything happening in this facility, from finances to personnel and staffing to internal affairs and investigations and treatment of detainees. We appreciate the county council's support of this. They also voted unanimously for this and appreciate the county executive getting behind this. The review, it took about a year to actually go through the process, the RFP process. Director Anders, when he came on, helped us broadly expand the pool of people, of teams bidding to do this review. We appreciate that because that helped lead to CGL, a group that has done similar reviews on, I believe, 300 different correctional facilities around the country. So I've appreciated the chance to work with the CGL leads on this and to answer their questions. I've appreciated them coming to the board, to staff at all levels throughout the prison to learn more about what is happening in this facility. And I'm going to open it up to Carl Becker from CGL to make a presentation of their findings, which I hope will serve as something of a roadmap for reforms going forward. Carl?
Jeff, if I could interject in there,
Yes.
sorry. I have a problem with having this presentation being made now. Because we didn't get the presentation, we didn't get the document until 9:04, which was like 10 minutes before this meeting started. So, as a board member, I like to prepare for these meetings and, it's a 128-page document. And, I take this service seriously and I like to actually read the document and want to ask learning questions about what's happening. So I appreciate the hard work that's been done by the Director Anders and the whole staff and, the consultant. And I know that, as you said, and you, Jeff, in this whole process, I know it's been a long process. But I don't feel.
Touch off of the bend here.
But I don't feel like I can have a coherent conversation about this without having consumed the document.
So here's how I propose we do this. I propose that we receive the report today and then set aside the bulk of next month's meeting for the board to respond to this after we've had a chance to read the entire report and absorb their findings. And I would ask that CGL plan to make themselves available for next month's meeting so that we can have a more educated conversation. I think there was obviously, I've been asking Scott every day for the last, 10 days or so, just about what the timeline of this was going to be. I think that they wanted to make sure that they dotted all the T's and crossed all their I's, and they went through you internally to make sure that everything was factually accurate, and underwent a legal review as well. And I think that we should not deny the public the opportunity to hear the report that the public, I think, the community has been looking for many months. But I also I know that this will not be the end of this conversation. So I would ask that we hear their presentation today and then reserve the bulk of next month's meeting to respond, for the board to respond to that.
So what's the content for the presentation going to be at a high level? And then we can have a thorough discussion next month. Is that what you're proposing?
Yes,
And how long would this presentation be today, especially with all the delays and everything?
15 minutes.
Okay. I'm probably comfortable with that, and I want to acknowledge the role of the chair and the hard work of Scott and others. That sounds like an okay plan, but I want to be certain that we don't come to the agenda next time and, the counselor says, well, it's not an agenda, we're not going to have it. So I will close down the meeting if that happens. So, make sure that we have enough time on the next agenda to thoroughly dive into this, because we'll have 128 pages that we have read by the next meeting. So I will not object to having this discussion now, because I know you line these people up to present. But
Okay.
and it says report now public.
This report, I believe, will be public today. Okay.
Okay, go. You can go.
Thank you for your concerns. If there are no other urgent concerns, then I'd like to turn the floor over to Carl Becker from CGL.
Thank you. And just to reiterate, we'd be happy to come back next month and answer any questions, and I can have the entire project team available if we want to get into like a deep dive into the details of the report. As you know, it's a lengthy report, over 70 recommendations. So there's certainly, we'd like the opportunity to discuss, with you in more detail what we found. What I've got for you today is a high-level summary of basic findings and recommendations, just the high points. Again, the report itself is very detailed, but this is basically a summary of the main takeaways that we took from the review. So I'll share my screen now. Add up. All right, can you all see that?
Yep.
Yes.
Okay. So we started this in earnest in January of this year. We spent a lot of time. We talked to probably over 90 staff at the facility, all told, stakeholders outside the facility, looked at a lot of data, spent time at the facility on all shifts. So we feel we've got a pretty good handle on operations at the Justice Center, and that informs our analysis here. So first of all, just some positive notes. When we went into this, based on a lot of the media attention, we were expecting, frankly, a pretty grim situation to get into. Maybe it's just a function of the number of jails we see around the country, but we were pleasantly surprised. We found the Justice Center to have a fairly clean, orderly environment. The facility felt safe. Some units had a great work environment, particularly the first floor, where the staff seemed to work very effectively and work together very well. So that was a pleasant surprise. I know that's not saying there are no issues at the Justice Center. There certainly are, and we'll get into that. But based on our expectations, we were pleasantly surprised with what we encountered. The other positive notes are the staffing challenges, which are the key issue that we saw here, are being addressed. The facility is making progress in hiring and filling vacancies, which is absolutely critical to sustaining some operational performance issues. And policies are being updated. We'll get into this a little bit later, but as we went through the facility and identified issues, Director Anders took the initiative to, in some cases, correct those issues immediately rather than waiting for this report to be issued. So that's a very positive factor. So without a doubt, the main issue that we saw is staffing. Based on our analysis, going through the facility and how it currently operates, the current mode of operations requires about 338 security staff. And just by way of reference, it's funded for 266 FTEs. So there's a structural imbalance there between what current operations require and the number of funded FTEs. And of course, the number of actual staff on board is well below the funded level. So the disparity is even more stark. Two factors really driving that staffing requirement are increased relief staffing needs and the policy that was put in place requiring 2 officers and rotating lockdowns on current housing units. If you actually went to that policy and removed the rotating lockdown and put 2 officers on every housing unit, then the actual operating requirements go up to 389 security staff. So those are the 2 factors that really drive the number of correctional officers, sergeants, lieutenants at the facility. We looked at the post plan, we looked at the current operations, and we developed an alternative plan which recommends 346 full-time equivalent security staff. And we do this by basically staffing the low and medium security general population units with 1 officer per shift, supplemented by rovers. We add 10 officers to the transportation unit to get that back up to its pre-pandemic staffing level. And then we provide adequate relief staff. And relief staff, that's basically the staff you need to essentially cover staff who aren't showing up because of their sick leave, annual leave usage, whatever reason they don't show up. You need to have officers prepared to fill in for those posts in lieu of using overtime, so we provide adequate relief staff. And again, that requires about 346 security staff. This will allow you to basically operate the facility as it was originally designed, normal operations, inmates out during the day for recreation programs, and it will reduce annual overtime spending by about $1.2 million. This we recognize as a big ask over current funding levels. So in the report, we propose a 5-year phase-in, adding 15 to 16 officers annually. And of course, again, we have to keep in mind, these are numbers that are well above current actual staffing numbers, and the facility continues to make progress in getting up to even the funded level. We believe they need to go well above the funded level and get to these type of numbers to really operate the facility effectively and efficiently. We looked at the organization of the Justice Center, and again, relative to jail systems that we see around the country, the current management structure appeared top-heavy. And the other primary issue we saw was unclear assignment of first-line supervisor responsibilities. We proposed a alternative command system structure, which reduces the number of majors and unit managers. And then we would designate lieutenants as first-line supervisors. There's been some confusion over the past several years between sergeants and lieutenants, who's actually responsible for supervising correctional officers on the units. We believe designated lieutenants with that responsibility is the best move, and those recommendations result in a net reduction of 8 FTEs from current staffing, all from the upper management levels. Okay. So I think I might have skipped here. Yes. Operations and policies. We did a deep dive into current facility operating policies. We found that while they're comprehensive and in terms of covering all the key areas, in some cases they're outdated. There were some modifications required to establish greater accountability, and in some instances they needed to be updated just to conform with contemporary standards. So we proposed updates to policies in the areas of roster management, use of force, segregation placement, emergency response, disciplinary hearings, staff grooming standards, and random searches and strip searches. Of these, probably the most critical in terms of risk management and potential liability were the use of force and segregation placement and the emergency response policies. Those we propose changes to basically put them in alignment with best practices that we see around the country and contemporary practices recommended by the American Correctional Association. We did a deep dive into organizational culture with focus group sessions with staff from all parts of the facility, just to get a sense for how staff feel about the facility and about coming to work. What we found is that, and again, these are staff perceptions. We're not saying these are accurate, but this is the way staff feel. We saw that staff perceive issues with favoritism, particularly influencing the outcomes of promotions and discipline. There was concerns about policy compliance being enforced inconsistently. And a lot of this gets down to issues in communication through the chain of command. A lot of confusion in terms of how directives on policy were being disseminated, who knew what was going on, and how that information gets disseminated to the line staff. So we proposed several initiatives. A lot of this is focused on improving communication up and down the chain of command. Regular staff meetings, requiring floor managers to conduct leadership rounds with their staff to make sure that everybody's basically on the same page when policy changes are being made, that it's clearly communicated to all staff at the same time. So there's nobody with differential levels of information throughout the facility. Recommended that you develop groups of officers, new officers, and basically talk to them before their first year on the job to identify ways their training could be improved based on what they're experiencing, what their experience is in the facility, both positive and negative, and then what it's going to take to retain staff that are coming on into the facility new. Hiring more staff is important, but being able to retain those staff and keeping them with a good positive attitude is probably just as important. We also recommended they establish a staff working group to develop proposals on the promotion process. A lot of the issues of favoritism were related to people not understanding the promotion process or not being transparent or just not really seeing how decisions were being made. So proposals to increase transparency and credibility of the promotion process involving staff to work in developing some of those initiatives we thought would be valuable. And then just, again, to get more staff buy-in on how the facility operates, develop a team from all levels of the facility to regularly review and propose revisions to select policies that affect everybody's work at the facility. Healthcare, we did take a look at healthcare, again, a very critical area of the Justice Center. Again, no surprise, the issue here is the inability to fill vacant positions. Did see some issues with sick call process and psychiatry and some of the management information. So our recommendations basically go to really going back to NCCHC standards of care as the basis for all your policies and really commit to pursuing accreditation. We know this is the direction the Department of Health wants to go. We really reinforce this as an important strategy for the Justice Center to make sure that they are operating consistent with the best standards that are promulgated in this area. In terms of staffing, we know you've issued an RFP to bring a contractor in to help fill positions. Hopefully that works out. But again, filling those vacant positions is critical and is certainly tied to improving the performance of healthcare service delivery in the facility. A couple other issues we saw. Again, this relates to the absence of staff. Nurse managers, rather than actually managing staff and mentoring staff, were basically doing direct care work because of all the vacancies. What we found in talking to some of the line staff is that they felt unsupported, lack of direction, made them more likely to want to leave the facility. So it's very important nurse managers prioritize their leadership and management functions and not get dragged into only providing line work. It's a difficult balance there. You need to be able to fill those basic nursing vacancies, but the managers have to be able to manage. The sick call policy needed to be updated to mandate that without exception, you collect sick call requests 7 days per week, holidays, and that they be triaged within 24 hours. That's best practice, and that's consistent with NCCHC policies. Currently, you only have telepsychiatry on site at the Justice Center. Telepsychiatry is very valuable, but it doesn't provide a complete replacement for on-site psychiatric service. So we'd recommend that you supplement the telepsych services with at least some limited on-site psych service as well. And then developing a system to track clinical and counter events would be helpful in terms of improving management dashboard reports. One thing that's pretty unique in this project, as we go through most of our projects, we'll inevitably update management and tell them what we're coming up with and what some of our recommendations are. And then the typical response is to wait for the end of the report, study it, and then proceed to implement. In this situation, we provided, of course, Director Anders with numerous updates as we went through the process. And what was a little unusual here is that rather than waiting for the end of the report, management has already gone ahead and implemented a number of recommendations. So these are just a few of the, excuse me. Recommendations that are already in the process of being implemented. A lot of these go to some of the organizational culture recommendations, getting staff involved in review of the promotional process, debriefing unsuccessful candidates for promotion, a lot of the communication, the bi-weekly staff meetings, the leadership rounds, new supervisory training, review of use of force policy. All these have already been implemented or in the process. So establishing lieutenants as first-line supervisors and establishing a public affairs team, staff newsletter, very positive initiatives, and they're already being put in place even before the report's been released. So that's a very notable response. It's unusual in our experience to have the facility go ahead and implement these number of recommendations before the actual completion of the report, and we commend you on moving forward with these. That, in essence, is a summary of the report, and I'd be happy to answer any questions. I know you'll have more questions after you get a chance to actually review it, but I'd be happy to answer any questions you have now.
Thank you very much, Carl. I have a ton of questions now, but I want to respect kind of the process as we referenced it earlier in the discussion with Tim. But I do want to create space for any board members who want to respond to anything now to do so.
Yeah.
Tim.
So, again, prefacing my comment that I haven't read the report and I want to take a deep dive into reading it, have a more thorough review of it, and I want to thank you for your hard work. But I'd like you to sort of comment on sort of a helicopter level of, and I've been on this board for about 3 years, and the path that we've seen in this jail has been interesting, to say the least. And I'm pretty proud of the service that this board has served, and there's been a lot of leadership changes, and there's been a lot of changes in the jail. And nothing's perfect, but I just want to comment, hear a comment from the consultant about sort of the trajectory of change that they see in the jail. And I did a quick skim, and I don't want to characterize the report yet, but just the characterization of the trajectory of change in the jail over time. They comment on that.
Yeah, that's an interesting question. In talking to staff, and it was very clear to us there's been a trajectory over time where the facility was frankly in a bad place in terms of management, organizational atmosphere. The Benasco years were very, very rough on staff. And that came through uniformly in interviews with long-term staff members. It's not an overstatement to say many of them felt traumatized by conditions that existed at the Justice Center when Director Benasco was serving. That, in conjunction with the deaths of the inmates that occurred in those years, really shook the facility. I think really had a profound impact on staff and operations. what we've seen, what I think you see over the trajectory are attempts to stabilize and bring back a level of normalcy to the operation of the Justice Center. As I said, you've got a great foundation. The facility is a good facility. The staff, the command staff are very well familiar with the operation. They're well trained. So you got a good foundation there. It's been a struggle to get back to that, again, that level of normalcy. And of course, then COVID hits and you've got that to overcome. But I think what we see now is a level of stability at the management level. Director Andrews has been here for, well, coming on a year now pretty soon. Coming off of COVID, improving the staffing levels, addressing some of the more longstanding issues in the facility. I think it's on an upward positive trend. I think it's very clear. When we talk to staff, we heard a lot of hope that things we're getting better, notwithstanding the issues that currently exist. So the answer to your question, I think it's moving in the right direction, directionally moving in the right place. And certainly the environment that existed 2 to 3 years ago is not what you have there now. It's getting better.
Thank you. If I could ask one more question, I don't want to monopolize room for other board members, but, and then again, I want to read the report more thoroughly, but I have a question about the staffing point in a broad sense, just I'm a numbers guy. So your point about staffing, and if I read the executive summary while you were presenting, and the rough number I'm reading is about 30% vacancies, and I know those numbers move around a lot.
Mm-hmm.
In the health and corrections. As experts in corrections around the country, when you evaluated that, I heard some sense that you're evaluating it by looking at pods and how many people needed to staff per over the time, and but I also wanted to take account of the census of the staff. I'm sorry, the census of the jail, and like how many people you need in corrections or in the health staff. Was that a factor? Because that's fluctuated a lot. When you first got on the board, it was quite high. The census of the jail was I'm sorry,
Like 1,200.
1,200, and we were hitting capacity of the jail, and then it dropped down, well below 1,000, and then with COVID it went back up again. But I don't know what the number is exactly now. But anyways, my point is it related to census as well?
Yes. So the numbers that I just quoted you assume essentially your current operations, in which you have basically one floor vacant, reflecting a lower inmate census at the facility. So that's what you need to operate at current population levels. We also provide in the report an analysis of what your staffing levels would need to be if in fact the facility was completely full. We don't see any indication it's going to happen. Policies change, you may get into contracting with other jurisdictions to fill those beds, but we do provide an analysis in the report of what your staffing levels would need to be if the facility was at its capacity, which is, fully staffing all those floors currently, whereas in the analysis that we did provide, one of the floors is vacant, is not staffed.
Other board members? Okay, so Carl, so I've got, just from your high-level presentation, I got a dozen questions here, and I'm not going to ask them all today, but I'm going to dig into the report, and I'm assuming that if other board members will probably have a lot of questions too. So can I ask you to reserve, say, 90 minutes for the next board meeting, and we will do a kind of a deep dive after we've all had the chance to process kind of the findings and maybe discuss some of the high level things with leadership here.
Yep, absolutely. I'd be happy to.
Beth and Nina, Tim, I know Bishop Henderson had to jump, but I of course want to give Dr. Garza, who couldn't be with us, but has been an integral part of the board the last 3 years, ample opportunity to really delve in on the healthcare side too. So is that course of action amenable to people? Okay. Okay, good. I know it was a lot to get this done for this meeting, and I appreciate everyone at CGL and everyone in the county, the staff that kind of touched this for your work to help ensure that the public could get this in a timely manner. We had talked about this, being in 6 months from the start of the year, and I'm glad that we, basically stuck to that timeline, since the delays in getting it done in the first place had been frustrating for some. So thank you again. We will be back in touch. I may have other questions that I send you via email, just for clarification, and then plan on a deep dive in August. Thank you, Carl.
We look forward to it. Thank you.
Okay. All right. I know our time is running a little bit short here, so let's try to get through the next few items quickly. Scott, can you give us an update on recruitment and retention?
Yeah, and Carl, I want to thank you also on behalf of Department of Justice Services for all the work that you all have done and helping us create this roadmap for continuing to make improvements here. Just want to point out for everyone also, we are the only jail in the state of Missouri that's accredited by the American Correctional Association. And we do have excellent staff here that work hard every day, and I really appreciate you recognizing and sharing how you felt so safe, because that's our #1 priority here. The assaults on staff have decreased by 30% just since November. And, also, use of force incidences are at the lowest they've been in the last 2.5 years, which you'll see later on the dashboards. So one of the areas that we're most proud of is recruitment and retention, because jails across the United States have been experiencing just what we had here, especially during COVID, with people going to work in positions where they could work remotely, or where they'd be less susceptible to getting infected with COVID-19. But during that same time, we've been able to reduce the number of vacancies from 84 on November 1st to where we currently stand, which is about 30. And so that's just phenomenal that we've made that type of progress, and I want to recognize all the staff that have been involved in doing that. And with retention, we were losing about 14 officers each month up until November of last year, and now since that time we've lost a total of 14 staff. So making tremendous progress there. Just yesterday we had staff attending a career fair. We've been doing that monthly, and we are the only jail in the state of Missouri and the only prison that has a Department of Labor certified apprenticeship program for corrections officers. And with that, when they come on board, we also were able to extend a $500 incentive for hiring that's connected with that apprenticeship program, and they also will be eligible to receive 30 credit hours at a community college when they complete that 1-year apprenticeship. So we're still looking to fill vacancies, and I know before we can request additional vacancies, we need to fill those positions that we do have open. So I encourage you to help get the word out. This is a great place to work. The county has excellent benefits, and we're the highest paid jail here in the state of Missouri now. Appreciate all that everyone.
Well, thanks to the, staff stepping up and going and visiting council members and testifying, I think had a big impact.
Yes, definitely.
Okay. That's pretty good news. It's some of the best news we've had in area of staffing in the last, 2 years.
It's been a long time since the jail was fully staffed. Yeah.
Any questions from the board? Okay, let's go to the next agenda item, which are, and I'm sorry that I couldn't make the ServSafe graduation last week, because the previous one that I had gone to was really inspiring. So thanks to all the staff who were a part of it. To tell us a little bit more about some of the initiatives that you've got going on, from voting to library resources on tablets to different vocational experiences and college classes.
Thank you, Jeff. Yeah, so we, just last week, we had a Serve Safe graduation for residents here that are working in the kitchen, and that provides them with the certification that they will need when they are released if they go to work in an occupation like that. And next month, we'll be continuing on with the management course for them as well. On Monday, we'll have in-person voting here for residents. The first time in the history of the jail, they'll actually be able to experience what that process is like, and we're working on continuing to help them register for the November election. We'll have that in place as well. And I really want to highlight the St. Louis County Public Library system that today, because of the heat, they're serving as cooling centers. But many of you may not know that they've provided over 50 different programs that are used now on our tablets for residents. And there's been a total of 60,797 views of those programs by the St. Louis County Public Library. So we just appreciate all that they're doing to help improve education here in the jail. Tablets have been a resource that have helped us through the pandemic, and we're using them as a resource to facilitate residents here communicating with their family. They have access to much more educational material than they had prior to that. That's been in place since November 1st as well. And just 2 weeks ago, we had a meeting with the St. Louis Community College System, and they now have committed to providing 4 college credit courses here for residents starting October 1st, and also a college preparatory class. So we're very excited about that. We have classrooms now that are outfitted with internet, so we'll be able to expand those educational opportunities for everyone.
Those going to be online courses? Or?
They'll be in person initially, and we see this as really a starting point. St. Louis University also has provided a reading and writing class here, and now for the fall semester, they'll be providing additional college preparatory classes. And I neglected to mention that the community college also will be providing WorkKeys assessments, which very, very important assessment if people want to go into the construction trades. We had building union diversity in 4 different unions here last month. And so the community college has committed to providing that assessment for people even before they're released. That'll supplement other educational courses that we already have in place, the GED and other programs.
So if I could ask a quick question, Jeff, I know we're short on time, but I love these tablets and I love all that information and access that's being given to residents. And I'm a professor and I love to do evaluation. So if you, you know, I think it's probably seems sort of obvious that this is probably going to help them make them feel better and they'll like it. But have you thought about evaluating some aspects of this, just sort of ask them what they like or get some metrics and what aspects of it they like?
Definitely, it's an ongoing process for us, so we'll try to share some of that information with you at the next board meeting.
Thank you.
Do you think there's, piggybacking on what Tim asked, do you think there's any correlation between the introduction of the tablets and the decline in the use of force incidents?
Yeah, well, the tablets were implemented at the same time, and so I definitely think that has been a part of this. And so I think we'll do some further evaluation and research, but there have been a lot of positive changes in that field.
So one more thing, you know, if you used it to sort of nudge people with like health messages or other sort of messages.
Yeah,
We communicate.
Liz, tell us about that.
Yeah.
We've put health information as far as healthy living and any disease process pamphlets that we used to hand out in person. They're being put on the tablet. We can email the inmates if they wanted to, so the providers can share information personally with them. And there's psychiatric information, there's mental health that came with the tablet that we didn't necessarily have to put on there. So all of the residents have access to mental health videos and podcasts and information. So we're addressing health and that, and we can develop forms and put them on there to be able to provide them with information or give feedback or that sort of thing. So we love the tablet.
Good. Darby, it seemed like you maybe wanted to jump in when we talked about morale and tablet.
Of course, we've been there for a long time. As far as the behavioral tools, the conference has been nothing but the experience of positive.
Good, a good incentive.
Yes.
Good, that's good to hear. I know that, all the educational stuff, I know you've had to spend most of your first year worrying about staffing, looking at this review and dealing with that, doing a lot of work with internal affairs and investigations. But I could tell just in a lot of our conversations that one of your real passions was education and vocational training and how you could bring more of these programs in. So I know you haven't always had the time to do that you wanted, but I'm glad that you're leading these efforts and that everyone, and that you're getting a lot of good buy-in from staff on doing that. Would you say that's accurate, or would you say there's been resistance? Or, if you had to characterize staff's response to a lot of these educational and vocational training initiatives, would you say resistance, cooperation, or enthusiasm?
I think everyone, there's great support for this. Staff are being able to be involved in development of these things, and so, as you can imagine, pulling together a process for people to be able to register to vote and have information about that process, and then coordinating with the Voters Bureau to get that process in place and carry that out. Does take some time. We've had 2 virtual career fairs with St. Louis University. So we have a $4 million grant from the Department of Labor here for job readiness training. So there's a lot of focus on reentry, and we know that if a person is unemployed, they're 8 times more likely to return to prison. So we're really focusing on education and employment, and hopefully that will lead to safer communities and fewer returns to the center.
Good. Thank you. All right, Aaron, we're running a little short on time, but you want to go to the dashboard unless anyone has any more questions on the program side? Okay, Aaron.
And I don't have the ability to share my screen though.
Okay. Well, I'm gonna call
Sorry.
things up from your email, okay?
I'm not listed as participant, otherwise I would do it.
Yeah, usually I think it's a permission that Ray turns on and off.
We do it.
There we go.
Oh, there we go.
Okay,
Good. Thank you.
right, great. Okay, so a few things. Yeah, I should only have a few minutes. A few things I wanted to highlight. Just to keep you all posted, the daily population as of today was 856. We've been fluttering in the 820 to 870 range for a while, but as of maybe February or so, as you can see in general, the overall trend is slightly downward, which is good. I also wanted to mention that use of force is still fairly low. It was up a little bit this past month due to, compared to the 2 months before it, but overall this is still not bad at all. Under 30 per 1,000 residents. So that is, in general, has been in a pretty good state. On the supplemental dashboard, the main thing that I wanted to draw your attention to is the 2 new windows here. One shows a resident to corrections officer ratio at the beginning of each month, and the other shows a count of open positions at the beginning of each month. Scott mentioned a few minutes ago that our open positions have been going down. The green here is the corrections officer, so that's the main number that he's referring to. and the overall total involves both correctional officers and other DJS non-correctional officer members. So in April, we had 53 open CO positions. Now we have, well, at the beginning of the month, we had 37, but I think it is going down again throughout the month. As for the overall total number of DJS positions open, it's gone down from 84 to 62 in 3 months. So those are both good signs. And not surprisingly, that is also going to bring the resident to corrections officer ratio down, because when the number of open positions goes down, that means the number of COs goes up, and therefore the denominator going up means the ratio goes down. So that is a good thing. Otherwise, I don't have any major changes to highlight in the dashboards over the past month. Overtime hours were right at about the same. Does anybody have any questions about the Justice Services data on either of the 2 dashboards before I hand it over to Liz?
Just a comment, if I could. I appreciate these last 2 additions, the corrections officer ratio, because that gets to a point I was making in the CDL report, because as you pointed out, if the residence drops and the officer stays the same, that'll drop.
Yes.
And so, you know, if you do anything like around policing, or, you know, the crime rate drops in the county or whatever, you know, that should drop that number. And, or if you raise the staff number, it should drop that number. So I think those are really good metrics to watch. It is kind of interesting to me, and maybe the director wants to comment on, the overtime hours don't seem to be dropping much, even though staffing is going up. Comment on that.
Well, there are a few reasons behind that. So the county's policy now is such that if a person is not required to work 40 hours in order to earn overtime, and so if a person doesn't come to a shift, they come in on a different shift, then they'll earn time and a half. So if the county is actually looking at revising that policy countywide, and I think that will make a big difference in terms of overtime, because as it stands now, if a person even takes vacation, but then they come back and they work a weekend, that's overtime. So it elevates the overtime. When someone doesn't come in,
Even when it's of their own volition?
yeah, so when it's, so what happens is then that doubles the overtime, because the person covering the shift gets overtime, plus that person will get overtime on the backside of it. So that's one policy that would make a huge difference. Now, as pointed out by CGL today, when you're short-staffed, we're also requiring, we have to cover with overtime. So there's
That's what I thought it was, but I guess you had just covered something I didn't expect.
But we're working, yeah, so we have really made significant progress. The other thing that you don't see there that's reflected in that is that the amount of income is higher now because of the $3 per hour increase for
Yeah.
corrections officers. So
Yeah.
so that can impact.
An economic.
Yeah, it's taken us a long time to finally get this resident to corrections officer and open DJS positions data, but fortunately it's finally now available. And Chanel, who works for our DJS, pulls it monthly, which is great information to have for the dashboards.
Yeah. So another thing I'll point out with this overtime is, under previous directors, they eliminated positions and supervisory positions so that there were just enough positions if everyone did come to work. And so if someone takes a vacation or they're sick, they need to be off for training or any other reason, then that requires overtime by someone. So I think, as the report pointed out here, there's a need for additional supervisors and additional staff, and that should help resolve that.
Well, I want to dig into some things related to that next month.
Yeah.
That the report touched on. Okay, you want to go to that corrections medicine dashboard?
Sure. All right, Liz, take it away.
Thank you. This particularly, the only really differences that we may have shown and somebody may have noticed is, psychiatric visits has gone up. The statistics have not been coded for the last year, properly. Doing telehealth visits were not apparently, coded, the way that they should have been. And so our statistical team noticed and identified and said that we've now included telehealth visits versus in-person psychiatric visits. So that's a change for the facility. Not a lot, but due to our electronic health record, we're not able to code and pull out data as easily as we would like to be able to do in order to present that to the community, anybody who is looking at statistical data. But we're hoping to rectify that in the near future to where we would be able to make sure that we are documenting appropriately for all the medical services that we provide in the facility. So as everybody's aware, we had a Sentinel event. This is for the month of June. Safety events, we still continue to audit labs and other medical care in the facility. And so that's gone up a little from last month, but that's something that we, of course, are always looking for so that we can correct and provide the best medical care possible. So that's the only thing that truly we recognized, unless there's a question from the board. Yeah.
Sorry, on this page and maybe on the next one, I noticed there's sort of a noticeable increase in the number of, or percentage with substance use disorders. And then on the next one, if you can turn to it here, is there's a pretty big increase. I don't know, you can comment on if it's a pretty big increase. The percent with mental health disorders going from 21% in December to 39% in the current month. That strikes me as a pretty big number, and I'm not, I think this is probably coming on society,
It is
the deal, and so if you could just comment on that, and, Dr. Khan, may want to comment on it as well.
just that our society as a whole and our population coming in we definitely identify mental health issues along with substance abuse issues. We need to remember that substance abuse is something that they identified themselves as that they have a problem, not necessarily something for us. Yes, if they consent with medical screening and urine analysis, then we do recommend. So it does represent what's going on in the community, mental health, substance abuse, and then those wanting treatments and requesting treatments, and that we're able to diagnose it and provide them with that level of care.
Sure, that's stressing your staff quite a bit.
It is, but we're working towards resolution for all of the mental health and substance abuse treatment program.
Can you go back to the slide with the substance use disorder?
I'm trying to get to it. There we go. Yeah,
Yeah, I'm trying to just understand if that looks, it looks maybe like there's some seasonality to it
Oh, yeah, that's good.
in summer months.
Well, yes, individuals are out in the community, and then things happen that end up bringing them in here.
Right.
Winter months, you're usually inside, so things are not as detectable
Yeah.
from law enforcement.
Or you wouldn't have the opportunity probably for as many conflicts that may result from the artifacts of drug use.
Right. So you are not wrong in your, everything always picks up in the spring and the summer,
Yeah,
and things will go down a little in the winter time.
yeah.
Although that wasn't really true last year, it was true in 2020.
Well,
I do also want to add about the substance use disorders that it's the data confirms DJS data that we've seen in the past month or two, both quantitative and anecdotal, that we did a presentation earlier this week where there was a huge number of higher than normal number of new entries into the jail for low to mid-level felony drug charges. So the fact that public health is seeing, corrections medicine is seeing higher percentage of provider visits for substance use disorders largely follows from that trend as well. What the external factors are, of course, harder to tell, but
Is this something that other counties in the region you think are seeing from your conversations with leaders in other jurisdictions?
Really an explosion of, in the community of people that are using and overdosing on fentanyl in particular, and that can be deadly.
Okay, real quickly, COVID update. We've given over 21,000 tests, 526 positives, and currently 11 individuals in the facility with COVID. No one is seriously ill. It is the mild symptoms, but yet coming through the door, they have tested positive with a rapid test, and we are treating them for their symptoms. So, thank you.
I just have to make my usual comment that your 1% COVID rate is probably a lot lower than the community, so I just would have to give you your usual plugs.
Thank you.
I'll
say staff outnumber the residents.
Yeah, exactly.
Well, keep the director from infecting everybody.
So I think, I think you're doing a really great job on the COVID mitigation.
It's a team effort. We do try very hard. So thank you.
Thank you for all you're doing. All right, our time is nearing an end. Were there any email submissions or people from the community waiting to make public comments?
There were not.
Okay, thank you, Penny. All right, we covered a lot, but we have a lot more to cover in that report, which we'll do next month. The fourth Friday of next month is the 26th. So we always meet Nina on the fourth Friday of the month. So we will reconvene at 9 a.m. On Friday, the 26th. And we will plan on, say, 9:15 to 10:45 with Carl Becker from CGL. We'll reserve a substantial amount of time in case we need it. So let's, probably try to keep other items off the agenda unless they're time sensitive, so that we have most of the meeting reserved for that discussion. All right.
Chair, before we break, don't know, on my calendar, I always reserve 3 hours for this meeting. But, I just didn't, I always reserve 9 to noon. If we need more time for that, I wonder if we, I know because it's public notice, do we, if you, as in your role, want to actually preserve a little bit more time.
Yeah, why
Maybe something we may want to do, given the depth of that report.
Yeah, why don't we do that? Why don't we plan for, to have, we always have the WebEx available until noon. So let's make sure that is additional time is.
We don't have to use it, but
we may use it if necessary, but yeah, given how much time we expect to spend on the report, I think that's a good suggestion. Thank you, everyone. There's no other business coming before the board. I move that we adjourn.
Second.
All those in favor, say aye. Aye. All those opposed, say no. All right, the ayes appear to have it. The ayes do have it. The meeting is adjourned. Everyone have a great weekend.
For awareness, NCCHC came while you were out.
Oh, okay.
So that was 3 of them. The 4th team member had COVID, so she'll be out. She'll be back August 2nd, 3rd, and 4th, and we'd like to meet with both of you. We're out. to
August
see-
3rd and 4th? Okay.
Yes, just so that you all can, because we're getting their evaluation of justice services, medical. So you might have to move forward.
Break that hat.
Yeah, I know. So we're,
Was it all day on the Thursday?
it's gonna come on the second, then Marty, just to be here until like 5, and then
That's okay. So
you're all
it is nice.
together.
So in the future, we have the double links.
Part of the
If you can, in
board,
the subject line of the email to the board,
and then
delineate
they-
between the two.
we gave them your email addresses, so they may get it